Now on the ward now is an intensive care consultant, Dr. Ron Daniels from Birmingham. Good to have you join us, Dr. Ron Daniels, this hour.
Noon.
With several measures put in place globally to curb the spread, where are we now? Are we any close to flattening the curve?
So some countries have come close to flattening the curve, and as the data from China seem to suggest, in fact, what they're seeing is a real slowdown and very few new cases and almost no deaths at the moment, if we have those data at face value. Other countries have struggled, and really where we've seen success, it's been around rigid measures put in place by governments early on in this crisis, with the first few cases, the first few deaths. Countries where lockdown has been early and consistent, countries that have invested early in testing are faring a lot better than those who've perhaps prioritised the economy.
So there have been so many projections for Africa. How would you say Africa has responded so far? Do you see a struggle, or do you see Africa moving in the right direction?
So I think, again, it comes down to individual regions, individual countries and their own behaviour and the behaviour of their population. Some countries in Africa have an advantage of relatively sparse population density. Others, of course, have very heavy population density. And even with the best measures in the world, poverty and a high population density will add to problems. So no one is claiming that the solution is easy. The solution is in the hands of individual governments as well as the UN and WHO regional offices.
All right. The World Health Organization is to release its latest strategic advice on tackling the pandemic later today, and there will be advice for countries that are looking to relax the lockdown. What could be the impact of relaxing the lockdown too early in some countries?
Well, this is critical. Lockdown is not a game. This is serious business. Right now, in countries that have lockdown, we're starting to see the curve flatten. Now, some members of the public, even very well-meaning and very articulate and educated members of the public, perceive that to mean we've beaten the virus. We have not. If we relax lockdown too vigorously and we allow people to continue living as previously, then those countries will see a second wave, is my concern.
But some countries, or almost every country, is grappling with trying to save their economy as well as curb the spread of the virus. How do you balance that?
So again, I'm not an economist, of course, so I'm not an expert in that area, but I think everyone is aware that the economic after effects of this crisis are going to be felt for many years to come. The question to governments is, what do you value more? Do you value your population and their health, or do you value the economy? But that's slightly flippant. A more serious way of looking at this is not just the elderly who are dying. The young are dying as well, those who are productive to society and those who can impact on economy. So it's not a binary choice between we save some lives or we save the economy. This is, in saving lives, we can help the economy to recover in the future.
All right, talking about, you mentioned people are dying, and talking about those who are young people are dying. We're also seeing that in the US, we're seeing African Americans dying at significantly higher rates than white American. Is there an explanation for this? So
I think there are multiple possibilities. We know that a part of an adverse reaction to COVID-19 is genetic, and it might be that there are some as yet unidentified genetic factors that make people of African origin more susceptible. We're seeing this in the UK as well. But we also have to be mindful that there are underlying conditions that might be more prevalent in people of African origin, particularly living in Western societies, and those include a higher proportion of people with diabetes, high blood pressure, obesity, than in the white population, even in the US. And the other factor, of course, is that often, and of course this is not correct, but often people of African origin in Western countries are at a lower socioeconomic status than people of Caucasian origin. And we know that that carries an impact because these people are more likely to be in frontline jobs, driving buses, driving trains, taxis, working in the NHS as nurses and so forth.
We're also seeing more infection rates with men than we're seeing with women. Is there also a gender perspective to this?
There really is, and this is what's quite striking about this condition. So for many conditions, we see slightly more affected men than women. So for example, admission to intensive care with normal pneumonia typically is around 55% men and around 45% women. But this has taken that trend and shaken it up. We're seeing more than 70% of intensive care admissions with COVID-19 in men. Does that mean that men are more prone to catching COVID-19, or does it mean men are more prone to having an exaggerated response and becoming critically ill? We don't know.
All right, so what do we also know about the impact of this on pregnant women and their unborn babies? Because we've seen, I think it was in Thailand where we saw the death of 2 pregnant women. Is there an impact on this or on the babies if they were to be born?
So in the early stages of this pandemic, we were reassured that this was not a disease that affected the young. And we now know, and we've seen in my country, we've seen in other countries, that children can be badly affected by COVID-19. And tragically, we're seeing a small number of child deaths. In terms of pregnant women, it doesn't seem to preferentially affect pregnant women. Pregnant women seem no more likely to develop an adverse response to COVID-19 than similar aged women who are not pregnant. So that's reassuring. And that's in contrast to, for example, swine flu or H1N1, in which a large number of pregnant women were affected. And we have to be mindful that in countries where seasonal flu is a significant problem, every year pregnant women and children die of seasonal flu, and in fact, in slightly greater numbers than we've currently seen dying from COVID-19.
Dr. Ron Daniels, so many perspectives on this. Thanks for sharing your thoughts with us on this.
Thank you so much.